listen-only mode.
Hello, thank you for attending our webinar. The Florida Association of Museums is hosting To Open or Not to Open, Things to Consider to Keep Your Staff and Visitors Safe. Want to go ahead and let you all know that we were having a little bit of technical difficulties. So just bear with us if anything kind of freezes or anything like that. We are kind of muddling through on the technical side, but it may end up being just fine. So, but I want to give you a heads up. Caroline, can you move forward with this slide? I want to make sure that we thank our sponsors, which are Florida Humanities and the Florida Department of State Division of Cultural Affairs. Next slide, please. So my name is Carmen Godwin. I'm the FAM Program Manager, and I just have a few housekeeping items. First, to let you know that this webinar is being recorded. The format is a moderated discussion. So we have 6 questions for the speakers, and they will answer them. And then afterwards, we will open it up for questions. However, if you have a question that pops up as we're going through this, please feel free to type it in the question box. On your control panel, there is either chat or question box, and you can just type things into there at any point. If you have a question for a specific speaker, just make sure to put their name in there, and I will make sure that when we get to the question portion, that I direct it towards that particular person. We do also have a few polls just to kind of get an idea of who's attending today. We have some handouts also. If you click on the handout section of your of your control panel, you can download a couple handouts. One is reopening procedures for tree to tree at Tallahassee Museum, and the other is signage from Museum of Arts and Sciences in Daytona. I also have a few more that weren't able to get uploaded. Some more signage examples that I will send you afterwards in a follow-up email that will come with the survey. And the survey will be not just for what you thought about this program, but for programs that you'd like to see FAM host in the future. Caroline, can you move forward, please? Okay, so the first thing I want to do is launch one of our polls. So on your screen now, you should see a poll that says, has your institution reopened yet? So if you can select yes or no, and I'll give you a few seconds to do that. Okay, I'm going to close the poll in 5. All right, closing the poll now. And then I'm just going to share those results. As you can see, 52% of those of you who are on the webinar with us today have not reopened, and 48% have. So that's just something I want to make sure that the speakers understood as well, a little bit about who's attending today. I have a second poll I'm going to launch right now. Which of these attributes does your institution have? So you can select more than one attribute in this section. Do you have outdoor exhibit event space? Do you have interior exhibit spaces only? Do you have large interior spaces with that are open and no doors between them? Do you have small interior exhibit rooms with like narrow passages? And do you have interior event space? So I'll give you a few seconds to, and again, you can select more than one on that poll. All right, I'm going to give you 5. All right, I'm going to give you just a couple more seconds since this one's a little nuanced. All right, I'm going to close out the poll now and share the answers. So, wow, 50% of you have outdoor exhibit and event space. 62% of you have interior exhibit spaces only. 58% have large interior exhibit spaces that are open with no doors. 65% have small interior exhibit rooms with doors or narrow passages, and that's a challenge, I'm sure. And 77% have interior event space. So I'm going to hide that poll now. And Caroline, can you go to the next slide? Our speakers here today, we're so happy to have CEO of the Bishop Museum of Science and Nature, Russell Dawes, President and CEO of the Tallahassee Museum, Dory Hitchman, Executive Director of Bailey Matthews National Shell Museum, and Andy Sandall, Executive Director of the Museum of Arts and Sciences. These people come from institutions that are extremely varied, just like yours. Shows how varied your organizations and your institutions are. Some have large outdoor spaces, some have smaller indoor spaces, lots of different challenges that they've had to deal with. So I'm hoping that each of you will get something out of this session that we're having today. Caroline, can you click the next slide, please? Go ahead, click again, sorry. All right, so our first question relates to museum preparation prior to opening. So for our speakers, what did you have to consider in preparing physical building and spaces, your exhibits, etc., before reopening your institutions?
Well, I can jump in here. We have a totally interior spaces, and we were fortunate that we could build a visitor experience that had a one-way pass throughout the exhibits, and without a lot of crossover between people. And so we did that first. We planned that. We planned all the signage and 6-foot spacing, protected visitor services with plexiglass and hand sanitizer everywhere. It was a challenge at first to get the hand sanitizer. Signage, as you see examples up there, and really thinking about what do people touch, and it's really not the adults, but it's the kids. And what are the high risk areas. And then we also built a plan for having more staff on the floor to help encourage the social distancing. So it was quite a lot of work in doing that to get it ready, and not cheap, right? And with more cleaning supplies, the types of equipment you need to do that, staffing during the day, planning for staffing during the day to clean. So that's kind of where we started, was with that one-way experience, and then the cleaning behind it, or before it and behind it.
And I think one of the things to look at is the one-way experience. We ended up using our back staircases and what would normally be just staff areas in order to keep that one way so that people didn't intersect. So I encourage you to look creatively at your building and maybe take people indoors they haven't been in before, and it may be a different path through the museum that you're accustomed to.
Russell or Andy, do you have anything to add?
Yeah, we're quite lucky here in Daytona. We're a larger museum. We have a lot of very, very wide open spaces. So we have a museum that naturally suits social distancing, naturally suits people being able to avoid each other pretty easily. So the most important thing we did, I think we've all gone crazy trying to source hand sanitizer during all of this. And I really reached a point where I wasn't confident in reopening if we couldn't guarantee we had a supply of it. And luckily, we had a distillery locally that started producing it as a part of its business. So we knew we could always get it. But what I didn't want to do is to have to open, then reclose very quickly afterwards because we ran out of supplies. The other thing I would really recommend everybody do that worked well for us, again, because we have 2 buildings here, we have very large buildings. I had my key staff walk the museum, literally every square foot of the museum, to rethink it from a visitor's perspective, because we were doing it from memory. We were doing it when we were just thinking about it ourselves, and we missed a lot. Lots of the places where the staff would go, where the staff would leave their spaces to go onto the museum floor. We really thought about the museum, how a visitor would interact with it, and wrote our plan for reopening based on that. We didn't just sit in our offices and try and remember what the museum felt like. We actually physically walked the building to look at every door handle, every place they could have a pinch point, everywhere they had to turn, everywhere they had to go into a different space, and thought through what could be the problems with that. And that's something I would really recommend for everyone to do.
Like Andy, we're pretty fortunate. The majority of the Tallahassee museum's an outdoor environment, but we do have, I think it's around 20 individual buildings. 14 of them are historical. As COVID started closing in on Tallahassee, we obviously were following CDC guidelines and learned a lot before we actually had to shut down with what the visitor behaviors would be, where our staff resources could be allocated. Like most of the other panelists, getting a handle on sanitizing supplies was a real challenge. I remember actually going to an ABC liquor store to buy a bottle of grain alcohol because that was all we could get at one point to do some of the sanitization. I don't know whether I and my staff were more interested in drinking it or using it, but we did learn a lot, and that helped us during our shutdown period to plan for what we were going to do when we could reopen. And as I said, the fact that we are primarily outdoors really made our lives a lot more simplistic than those of you that have interior spaces almost exclusively.
The other piece we did have to do was to physically block off, tape off, sign off any of our exhibits that were interactive, which unfortunately was some of the newer exhibits and some of the fun things, but it's important to message for people so that they understand that if you've purposely done that, it's not that exhibits are broken, it's that you're doing it for the safety of the visitors.
And I will just say we have yet to open our early learning exhibition for children. We saved it actually for our summer camp, but really thinking about how we open it. There's many things to touch, and we're looking at it more as a platform for an experience in there as part of the one-way path. So, but we had no trouble opening the planetarium. People have felt very safe. We alternate rows, do 2 shows, alternate rows each time, and then sanitize the whole thing. Gotten very positive response on that.
I think that was something I'm thinking of the long email chain myself and Brennan were involved in. There were very few specific directives for museums that came out of the governor's executive orders. We were actually quite lucky that he specifically called out hands-on children's activities in the first one that gave us that guidance. But I think for most of us, we've had to look at the executive orders and look at the CDC guidance and see what's our best fit to the commercial world. So for the planetariums, I think we were all looking at what they were doing with movie theaters. And if they reopen movie theaters, we felt we could reopen. For things like our museum cafe, we had to follow the guidance for restaurants, things like that. But with a large organization like ourselves, we have so many little moving parts of things like our rentals business, renting rooms out for meetings and things. We have to look in so many different areas of the guidance and try and pull them back to find which are the best fit for the museums.
The other resource in all of that is the health department. I have the epidemiologist on speed dial, and they've been a great help in helping us work through and enhance the CDC guidelines where we needed to.
Well, with our aerial adventure courses, Tree to Tree Adventures, we thought when the governor said we could all open that was just covered under the standard museum opening, until we found out from the Department of Agriculture that no, we were in fact going to be controlled by theme park rules, not museum rules for that. And part of that required that we do a reopening plan, which is one of your handouts, and to get that handout approved by your county mayor. And if you didn't have a county mayor, you needed your city mayor to approve it and the county administrator to approve it. That became quite a journey getting those approvals. And ultimately, they wanted us to basically waive the county and the city from liability restrictions. But in doing the reopening plan, we realized there was very few places that addressed zipline courses. But fortunately, we found Europe was ahead of us. So we were able to get a hold of colleagues in Europe to get some guidance to help us shape our reopening plan. It was a fun journey. I mean, it took us a month to get our aerial adventure open after we opened up the museum.
I also think if you have primarily indoor space, which we do, and obviously we're in Sanibel, so it's really hot this time of year, but our staff, our program staff, took the bike path that we have coming into the museum, and they created just really simple signposts and created an outdoor exhibit that walks people down that bike path and has content all the way, and they're spaced about 12 feet apart. And that has been surprisingly popular, just to give people something new, something different that is outside that makes people feel comfortable. So I encourage you to look at some of your outdoor spaces that you would never think about them being exhibit spaces, and try to develop something that provides a little value added, because obviously the experience inside will be different.
Yeah, we learned that obviously the CDC guidelines evolved as we learned more about the pandemic. We had our playground closed. In fact, many of our buildings are still closed just because of sanitation limitations. But CDC then came out saying that to sanitize your boardwalk railings, your playground structures was no longer necessary, which was a great sigh of relief.
The other thing I'll add is we rethought our hours. Just because you were open a certain period of time before COVID doesn't mean you have to be afterwards. So we shortened our days. We went to 5 days a week. We shortened the hours from 10 to 4, and that's kind of our bell curve of entrance anyhow. And we're doing time ticketing, so that allows us to kind of project, although we do take walk-ins. But just so rethink your hours. It's okay to do that. And I know several places I've seen open have been doing the same thing.
Okay, great. Thank you so much. Caroline, can you move to the next question, please? Okay, so the next question relates to preparing your staff for opening. So please discuss any discussions, walkthroughs, trainings, or other preparations that you guys had to make before reopening with your staff specifically.
I think this is probably one of the hardest parts, is staff. It's one thing to get a physical space prepared, but to have people who have been working from home and bring them into a public environment, you had to make sure that they felt comfortable first. And it was a process of developing the plans. I think Russ showed some plans. I have plans. We have memos about COVID. We have plans on how we're step by step going to reopen, what the visitor experience is going to look like. So everybody from the custodian to a director level, we're all informed of the same thing. We reiterated our expectation of masks and hand sanitizer and wash breaks and that kind of thing. We brought people in for a training. We staggered it, so we had 2 different groups. We walked them through the whole experience. So everybody got to experience everything. And so we tried to get as much done just before we opened, allow for questions, and then allowing for them to and make suggestions, accepting that. So it was a long process, but well worth it. feedback from staff is that they realize that they're safer here than they are a lot of other places.
I think that's really important emotionally for the staff too. We found when we had been working from home for a couple of months that just being back inside the museum felt very strange, and being inside anywhere doesn't feel safe to most of us. So it was important to have the staff have a couple of days just to be back in the physical building and start to be comfortable with being in the building. And I don't underestimate the importance of just recreating what normal is before you open to visitors.
Yeah, it's funny. I'm thinking of Brennan's comment there where, I mean, we have about 50 staff here, of 20 plus our visitor services, security, front of house. At the time when we came back in May, we couldn't put them all in a room together because they exceeded the allowable amount of people for a gathering. So we were very lucky the week we were doing all that preparation to reopen, that it was a really nice sunny week with a bit of a breeze, and all of our staff training was out in our garden, and everyone could sit around, and I had to stand on a wall and shout to everybody, which was fun for my voice, having not spoken to anyone for about 3 months. But the best thing we did was the constant communication with the whole staff while we were closed. We had actually set up a Facebook group just for staff, a private group where we could chat. And I made a point of every time there was anything in the news, anytime there was any announcement from the governor or from the city or the county, I would be in there explaining what it meant to us, what it changed my thinking, how it was changing my thinking. I would also have a meeting every week with my supervisors by Zoom, and they would then have meetings with their departments on that. So we were all pretty much in the same space when we got back together. We just really outlined what our thinking was of how to reopen and what we were going to do and what our plans were, but then allowed the staff that room to give their own input and to adapt it for how it best worked for them. One of the interesting things, I don't know if any of the others had this problem as well, is we did have some staff, we kept most of the staff working from home who could work from home. We minimized the amount of people who needed to be into work. We actually had a few staff we had to ask to not come in as often because they'd missed that interaction, they'd missed that socializing. And we had a few staff we had to pull to one side and say, if you don't need to be here, please don't come in, because we were starting to get problems that they were congregating, and we needed to break that up a little bit. So one thing I would recommend is really spend your time observing your staff and how it's working, to make sure that it's working as planned, really.
I think Andy hit a good point, trying to assess basically individually with each of your staff members, their outlook toward the whole thing, their emotional comfort zone, how they're responding. I mean, we've had some staff who probably thought they were going to die in the afternoon, and others that were taking way too many risks, and how you mold all those different perspectives. And frankly, we probably lost some staff that just couldn't feel comfortable. I think one of the things that surprised me the most was the impact it had on our volunteer corps. Given many of our volunteers are older or at risk, many of them still are not back providing their great skill sets to us, which has added a whole nother level of workloads on the hired staff. I think Andy had mentioned earlier about assessing risks in the building. We had to do a risk assessment in terms of staff credentials. We have a wildlife collection, very talented, skilled staff that we realized if we started losing those staff members, we could have some real problems. So we had to implement a whole different regimen for them to ensure that if any one of them came down with COVID, there was another group of them that never would have been exposed. So kind of shift changes to make that sustainability work.
That was really smart, Russ. I've got the same thing with animal care and had to think about that. The other thing I'll recommend to everybody is be sure to be in contact with a labor attorney, because you want to make sure that you're stating correctly to the staff how, this is what we're doing, this is why, and what is legal and what's not. You have a job for staff, and you knowing what you can ask them to do and ask them not to do. If they want to just work at home, but their job is not at home, you cannot do that. Then there isn't really the job for them. So I encourage you to make sure you have the legal advice to support what you're doing.
I think you also,
that was a conversation. Oh, sorry, Dory. Go on.
you also need to set expectations for what is appropriate conversation between employees. We had a problem early on that some of the older employees were assuming that the younger employees were, by definition, not acting as safely in non-museum hours. And that was obviously incorrect and also offensive to our younger staff who were taking it just as seriously. But you will find the entire gamut of your staff, of everyone who, people who don't care and aren't worried, all the way to people who are terrified, and trying to manage those interrelationships between staff is very difficult and delicate, and you have to be obviously respectful of everyone, but ensure the safety of your entire staff, and that is not going to be easy.
And I think
Actually,
I was just going to say, I think part of the problem is there's so much misinformation circulating. It's really hard for staff or the public generally to understand exactly what's factual. I liked Andy's comments about sharing information to his team as he found out. I mean, it helps.
I mean, one of the reasons that came about was right at the start of this. One of my staff, when it was starting to come out and we were starting to be discussing making some changes, I had a staff member send an all staff email that was the isn't it funny how this only happens in election years meme, and don't believe everything you read in the press. We had to stamp that out very, very quickly, and that's where the idea of a group came from. But I'm thinking back to what Brennan and Dory said. One of the early conversations I had with my supervisors to coach them about how they need to approach this with their staff is, for a lot of people, a lot of my particularly my volunteers, but a lot of my visitor services staff and front of house staff, this had been a very safe job. This had always been, one of the safest jobs you could possibly get was working at the front desk of a museum. And it flipped overnight, and it became a very, very dangerous job in some cases, became a very, very high risk job. And they had to be ready for that the staff that had always thought this was just nice, we get to meet people, we get to be friendly with people, we get to provide that visitor service, are suddenly on the front lines, the same way people working at Publix were and essential workers were. They had to be ready for that realization to hit some of their staff.
That's a really good point. All right, Caroline, our next question. Now I'm probably we might not take all of our questions because I do want to make sure we have time for the people who are writing in questions. So we'll just see how this goes along. But this question relates to your visitor experiences. So how have you monitored your visitor experiences, and what kind of feedback have you received? And then what do you do with that feedback? How have you responded to it?
We do a visitor survey to everybody that has, we're doing time ticketing, so we have people's email, and we send a survey out, and we've been getting a decent percentage back, and about 10% back, and people are pleased with it. People feel safe. They've complimented the staff as being helpful. They're glad we require masks. They're glad to see the cleaning. The hard part is we can't have cleaning all the time for everybody. So we do get a few people say, well, I didn't see anybody cleaning, but it doesn't mean that we haven't been. It just means you might have missed that person that just went through. So, and then people want more. We've had people, we built a 12-minute planetarium show using our Digistar system. So we're doing small stints in the planetarium, no length of time in there other than that, and people want more. So that's what we're hearing, is that the people who come have enjoyed it, very thankful to be there, thankful to have an experience. We've even had to do some of the, we've accommodated, so ADA, this is where these labor attorneys are great, and just having an attorney, is ADA requires now that you accommodate people that can't wear masks, but that doesn't mean you have to accommodate them in the hours, your regular museum hours. So we ask people if they need an accommodation to let us know. We've had a few groups come in when we're closed and get an experience, and they're thrilled that we've been able to offer them an opportunity. You know, we learn as we go, and we have definitely done that.
How do you manage my staff would not want to do anything with visitors who are not wearing masks. They would not feel safe. Renan, how do you manage that with people who don't want to wear masks?
We've got the one-way path. You know, we let them in, but we got the one-way path, and our staff have followed behind them at a distance, letting them experience. We're not leading the tour. They're going ahead and then taking Clorox wipes behind them and just cleaning everything they touched. I mean, it's been small families, it's been elderly. It hasn't been an issue, but our staff just keep the distance.
I think one of the things that has kind of reassured me that I'm in the right career is hearing from all the people what a wonderful respite we have become to them, a place to escape from the challenges we're all facing outside in the world. And I've had people in tears thanking us for being open. This was both before and after closure. People seem to be self-monitoring themselves really well. I think we all the other day agreed that the attendance numbers we're experiencing right now are nowhere near what they normally would be. And it'll be interesting as those numbers grow, whether people will be as accommodating and receptive to the requests we make of them. I think right now the people we're seeing are rule followers. We haven't run into too many, I'm against that. We did have one creepy guy who had a professional camera wearing his mask with his wife going up to all of our visitors who were outside, properly distanced, doing close-up photos of them and their children, which created real problems. And his whole routine was, we weren't following the rules with masks. Well, we had to explain to him that masks aren't required outside and social distancing. We eventually had to call the sheriff's deputy to resolve that issue, but that's really the only time we've had a problem.
One of the surprises that we found with visitors was because they have all heard that museums can open at 50% capacity, and the reality is that none of us are anywhere close to 50% capacity at any given time during the day. But there's a perception. We have not done a lot of advanced ticketing in the past, but we pivoted and we went with Eventbrite, which is really easy. I would suggest it to any small museum that doesn't have ticketing. We found people wanted reassurance that they could come at the time that they plan, because they have an expectation that they might not be able to get in because of the limitation of 50%. And they also, we found a flip in our visitors. Normally our visitors would come in the afternoons, and we found now that people are booking in the morning, and we believe it's because they think it's cleaner in the morning. So we shifted, and we now promote that you can book in the morning, you can book in the afternoon, and we are cleaning in between. And that has helped to sort of even out those numbers. But you have to remember, I think, and it was a surprise to us, that visitors often have the perception that they might not get in because there are too many people already. So
I'm thinking back to when this first came back and we were put on to 25% capacity. And I was thinking, if I can hit 25% capacity of our building, it'll be the best day ever we've ever had. That'd be fantastic. And then by the time we'd gone from preparation to opening, it moved back up to 50%. So we had to redo all our signs immediately for that. One of the things, I'm working in a community that was and continues to be very mask wearing controversial. There's a lot of controversy over mask wearing still in this town. We even at one point, because tourism is so important here and we were losing so much of it, at one point the city was basically marketing itself as we're the beach that's open, we're the beach that doesn't care, our boat ramps are open, our beaches are open, our bars are open, come and enjoy. And we were just getting a lot of people from the central Florida region coming over here. Because of that, when we first reopened, I didn't enforce a mask wearing rule. My concern was that arguing with people who were vehemently anti-mask would put my staff at more risk and make them exposed for a longer time than just waving those people through. And you'll actually see on one of the handouts, there's some photos of how we set up our entrance, our front entrance, where we use tables to physically distance people from our staff and put the plexiglass guards up and everything. What changed for us is when the city finally lost patience with the county and the state for not putting an ordinance in place. So when the city made an indoor mask ordinance, we adopted it immediately, and we've actually seen our attendance gone up about 20% since that happened. I think people felt more, and our visitors in general have commented, they felt more wary of coming out not knowing if people would be wearing masks, whereas coming to somewhere where they know everyone's being told to wear a mask, they feel a lot more confident coming to us. So we've seen our attendances have actually risen, and our confidence level of visitors has risen since we had the mask ordinance added. The one thing I would add as a side point to that is when we made that announcement, we had our marketing team and our social media manager sitting on all our social media, immediately hiding all the inevitable never coming to your museum again from some guy in Michigan who is just trolling mask ordinances all over the country. And we spent the first hour of that announcement just hiding comments from people calling us every name under the sun.
We sold a lot of masks that one of our volunteers was making that are octopus motif and shell motif, and people were thrilled to have them. If you didn't have a mask, you could get a paper one for $2, and you could buy one of our nice fabric motif ones for 10 something, and we sold out like 3 times over. So new revenue source.
We partnered with our health department, and they gave us 5,000 masks to hand out, just to establish, that this is good. I've seen we've only had a couple of instances where people have fought it, and really we're a private nonprofit. That was at the time. Manatee County just put mask ordinance in place yesterday. So we've been doing this since June 3rd, and it's just a few altercations, but in general, people who want to be here are happy to comply.
Something you had mentioned earlier, Ann, was that about cleaning. There was a recent study related to tourism that people want to see people cleaning. They don't care how they're cleaning or if they're cleaning effectively, but if they see people doing something, they feel it's okay.
Well, we're cleaning. It's just we have nooks and crannies in a big museum, so.
Yeah, we decided it was as important that people saw you cleaning as it was to clean.
Oh, I agree with that, but you have a staff limitation. How many people do you have cleaning? And with nooks and crannies, and I cannot see most of the staff here during the day. So I think you just have to wrestle with it with yourself.
Have a volunteer walk around with a cleaning rag. They don't have to clean, but at least people could see them.
And actually, all our volunteers came back. Ours have been, they were chomping at the bit to come back. And so we've got a plexiglass places for them to sit and help guide visitors. We have them back in collections. So they're coming back.
Since several of you mentioned opening attendance numbers, we did have a couple questions from attendees about your specific opening percentages compared to last year. Do you mind each of you just kind of letting us know what those are?
I'll start. I know our museum attendance is running 45 to 50% below normal pre-COVID for this time period. Our zipline courses are running about 37% below normal. It's doing much better than museum attendance, but it's not where we want it to be, but it's manageable.
We are also operating at about 50% below normal. It's a long, slow death. It's hard to make those numbers work. So,
We're at about 25% of normal in terms of visitation. People are buying more in the store, though. We're finding that the cost per, the spend per visitor is higher than it was last year.
yeah, we're only down about 30% in the store, less 25.
When we reopened, we didn't have our children's wing and our planetarium open, which are two of the biggest drivers, and we were running about 25% regular attendance. Since they reopened, we're back up into the 40s somewhere. But we're also seeing our membership isn't being affected. We're seeing a lot of loyalty from our members and our membership. We're seeing a lot of people are giving, are actually increasing their membership level or are making donations with their memberships when they come in.
Yeah,
Okay, great.
our
Sorry, go ahead.
audience has been very generous with their donations during this time period. In fact, a member who's only been a member, family member since 2017, something like that, just sent us a $10,000 check, and their biggest gift before that had been $100. So
That's wonderful.
they value us.
Great.
We are going to take one more of our 6 questions so that, because we do have a couple more questions from audience. So Caroline, do you mind moving forward with one more? Okay, so I guess, what worked well, what didn't, and what changes have you made from your reopening plan? And some of you have already talked about that, but if you have anything else to add.
Well, we changed our pathway a bit on the basis of looking and seeing where we might have bottlenecks. We changed our hours. We were watching the pattern of how people load in. It's very interesting that when you've got this time ticketing, that people really kind of load in and buy tickets the night before or the morning of. So what you start with in the morning is not going to be what you end up at the end of the day. We're seeing that build throughout the day. We ended up adding another hour. We had because we were seeing people come in at a different time. So it's the mindset of, what you start with you don't need to end with that. Make the changes that gather the feedback from the staff, from the visitors, and make any changes you need to make.
Yeah, we reduced our tree-to-tree from 7 days to 5 days, partly to save staff costs, but we didn't have enough visitation to warrant 7 days a week, and that's worked out really well. It kind of concentrated the audience better. I think if you've got your staff all on board with your plans and they live it and breathe it, you adjust on a daily basis.
I think Russell's absolutely right. As an example, this morning it came up that I had 2 employees who were sitting in our lunchroom, which is a closed lunchroom. There are no windows, there's no ventilation. And it was morning and they were sitting there without their masks having a conversation. Another staff person came in and he was very upset. And so we're talking about having to remove the table in the lunchroom. So you cannot physically spend time with other people in the lunchroom. I mean, every day there is something you didn't anticipate that you have to figure out how to manage.
Yeah, I mean, we've got really lucky that most of our plan for reopening, we haven't had to change that much. We pretty much nailed it straight away with making everyone so distanced and everything. But my job has kind of become the chief speculator of the museum right now. Most of our senior staff meetings is basically just discussing what's going to be the next thing that changes. Biggest one recently we dealt with was with summer camps. What were we going to do with summer camps? Can we make them virtual? Then the rules changed and we could do them in person. Now we're dealing with the extension to when school restarts again and how do we cover that? So what we're trying to do is just constantly be scenario planning. I mean, we have a scenario for if we have to close down again, things like that. We're just constantly always thinking, what will be the next big shift that we have to adapt to so we're ahead of that?
Yeah, I think we learned a lot from our closure and the virtual programming. Some of our virtual programming for the closure probably is going to become permanent because they were so well subscribed. We will probably see our early childhood program that's had over a 45-year history succumb to COVID. We can't hire a director for it. We can't find teachers. Parents aren't comfortable sending their kids. So, you know, there probably are going to be some long-term costs to COVID.
We did have a successful set of summer camps that just ended, and parents thankful that we had it. But we have big double classrooms. We've got 3 sets of double classrooms. We could really spread kids out. They're just thankful the kids had a safe place to be and learn at the same time. I will also say, go back to the fact that the staff issues are the big issues, being nimble, answering questions, because I have there's 46 of us all together, and peripherally, and I've had a staff member that has had COVID. You know, the husband gets COVID, or this, you know, or they know, you know, they get exposed to it. So addressing what it really means to be, what does exposure mean? You know, what does that mean in terms of if somebody gets it here at the museum, and figuring out how transparent you can be, because you can't tell names. People know, you know, small museum, but that kind of dealing with those issues and having the right verbiage of, you know, quoting CDC or the health department is really in your quiver full of messages, is really important to keep staff feeling comfortable and safe and knowing how to deal with it.
And I think to piggyback on what Russell said, don't automatically think changing something is negative and canceling and getting rid of things, and it's a shame we have to cancel it. When we did we do on-site and virtual summer camp right now. Our virtual summer camp, and I'm hoping Joanne isn't on the chat here, our virtual summer camp is pretty much picking up mostly families from Orlando. It's not the Daytona families. The Daytona families are coming in person, but we're now getting people from all over Central Florida signing into our virtual summer camps. We're planning our gala to do a virtual gala. We're now looking at, well, we can advertise this all over the I-4 corridor because it's working with the Smithsonian Jazz Orchestra. Now you don't have to physically plan driving all the way to Daytona to see a concert. We can sell that all over to jazz lovers all over the state. So we're now starting to think in terms of, well, this is an easy way of us changing our programming to be better, to be statewide rather than just be, can you physically get to the museum?
Yeah, our adult Zoom lecture series that happens every week now has an international audience. We could have never done that with traditional programming.
It's just hard to monetize it in the same way.
Yeah, that's the hard thing. We have a tip jar that actually people are fairly generous with.
We are going to move past question 5 and 6 so that I can make sure that we get a couple questions answered for the audience. The first one is, what would the panel recommend for museums that only have one staff and the remainder are volunteers? This particular institution is a small historic house museum that usually offers guided tours. So if you have any advice for the smaller museums that are mainly volunteer driven.
Well, I think it first depends if your volunteers are comfortable coming back, depending on age and health. We've had some volunteers that are like Brenann's that are chomping at the bit to come back. And we have some that are saying, I'm sorry, I just can't do that right now. So first and foremost, if you're dependent on volunteers, you know, do you have enough that are willing to come back to make it work? Most of the historic homes that I know are not currently open.
We did some video tours of our historic buildings, so that may be another approach to take. Is, I know it's not ideal, but it does provide people access to your resources.
And again, I'll keep saying, just because you have to do something differently doesn't mean it's worse. You can do it. You can do your visit. You can let people into around your museums differently, but that doesn't necessarily mean, from the visitor's perspective, it's worse than how you would wish you could do it.
Well, and you can take I've got a brilliant facility staff. So you get a cart from Home Depot and you mount a plexiglass in front of it and a museum branded skirt or something on it. And that's a portable station that a volunteer could be at that protects them. And maybe you've built a one-way tour through the museum house. They're there to answer questions at a couple different locations. You could put that station everywhere, but treating them just like staff and protecting them. Some of them may be very willing to do that, but just create that one-way tour and information to go with it. You might be able to continue.
I really thought Bridan was going to say you put the guests in a cart surrounded by plexiglass and push them through your museum.
Push them through, right?
Hazmat suits.
I might explore that one this afternoon. We talked about doing some of our programming. We have our visible storage facility, which is a big glass wall all the way through it to look into the storage. And we've been thinking about doing like curators tours where they're on one side of the glass and the visitors are on the other. But then we start to turn into a zoo, I think, rather than a museum. Come and feed the curators.
Do any of you have any handheld, like audio, tour wands, headsets, those sorts of things? And if so, are you using them? How are you cleaning them?
We switched our scavenger hunts and the kinds of things that normally we would have handed out, clipboards or pens or pencils. And we've transitioned all of those, so it's a QR code that people pull up on their phones. And people have been very happy with that and very receptive, so there isn't anything that's touchable.
Anything like that we had that was scavenger hunts, they're all just printed, photocopied on the table when you check in. You take one and you throw it away, and they're all disposable. Everything like that, museum maps and everything, they're all disposable now.
I would think that the audio units would be fairly easy to sanitize after every use, but we aren't using anything like that.
Okay, I have a couple people who've asked questions related to specifically staff who've tested positive, like how you've dealt with that, especially if you have multiple staff. And then, like what are your guidelines for people returning to work? Because the CDC has sort of changed their guidelines on that as well.
Since I have experience in that, on a number of different fronts, I'm happy to share with anybody if they would like to email me the words I've gotten from the epidemiologists. This is where getting the health department's guidelines is so critical as you protect your museum and any liability and staff concerns, safety for everybody. So that's what I encourage people to do, is to take your situation, share it with your health department, and let them help you build those scenarios so that when you get them, how to deal with them. Because I've had to send a whole team home because, and like Russ is protected. Fortunately, I had another team that hadn't been exposed. And all of them turned out to be fine. But it's you want to make sure you have the right wording from the health department, I believe.
With our Tree to Tree Adventures, as part of the attractions reopening plan, we do a warning checklist for symptoms, that type of thing. If several of the symptom checks come back bad, we send the employee home, request them to get a COVID test, and provide us with either a negative or positive. Obviously, if they test positive, then they go into the quarantine situation. Cannot come back until they can produce another positive or a negative test.
And see, the health department contradicts that. They say they like the 10 days beyond. So I think that's where you have to establish what's right for your museum and your county and your city.
Yeah,
Yep.
and I can tell you one experience I had with our health department and trying to seek guidance. I was on the phone on hold for 3 hours, and all of a sudden somebody picked up the phone and said, "Jacksonville Memorial Hospital, how can I help you?" I never was able to reach our health department. So you have to be prepared for that as well.
Fortunately, the health department director is on our board of directors. I have a direct line. I'm happy to share the words I have and the scenarios I have. The COVID has hit home. We had a board member pass away on Friday. And, so we are treating this seriously. but we are open and for business and providing experience that people can't get anywhere else.
And I think, as you said earlier, Brennan, this is where your personnel attorney can also be of help.
Mm-hmm. Yeah.
This is also where it's really important to stay on top of your staff. And my point about not having them just socializing and hanging out together at work. We've had 4 staff who we've had to quarantine because they felt they'd been in personal contact with somebody who tested positive or thought they tested positive, but they had never been around any of their co-workers at any time. They'd all been coming in on their own to their offices, leaving without being around people to get exposure to them. And we got very lucky with that. 3 of them had their contact over the weekend, so they didn't have to come back in and hadn't seen anybody at all. But that's why we're trying things like we have, if my staff want to get together and chat about things in person, we ask them to go do it in our library so they can sit at the far end of a large table. Just that, getting out of that culture of just popping into each other's offices to chat, to have conversations in the corridors, all those tiny little things you have to really concentrate and try and manage to make sure people are avoiding those long 15-minute unmasked conversations that are the worst case scenario for spreading.
Particularly if you manage a museum as I do with a small staff, you know, one case could wipe out everything you're doing. So we have a non-negotiable, everyone wears a mask all the time in the museum. Even when we're meeting and we are, you know, if we have a meeting, we are sitting at least 6 foot distance from each other, but it is not an option for the staff at any time not to be wearing a mask.
I would also suggest you know exactly what a positive and negative test result looks like. We had an employee who falsified a COVID test as being positive. It looked like they had copied it out of Google or somewhere, but that was the first I never thought I'd run into.
All right, we do not have time for additional questions. However, I wanted to, first of all, thank all of our speakers for being here, taking the time to share your knowledge and expertise in reopening and the challenges that you've had and how you dealt with them. I wanted to let everyone know that this is the contact info for our speakers, and they have all offered that if you have specific questions and you need additional, you know, information or help, they're all willing for you just to reach out and contact them and kind of help you through the process. I will make sure to get these emails to you through the email that I send with the survey that's going to come out either later today or tomorrow. We will also make sure that you have a copy of the recorded webinar so that you can review anything that you may have missed. I also just wanted to make you aware of upcoming programs. Please, if you're not signed in on our for our newsletter, make sure to do that and keep up to date. We've also posted on our website what's coming up, but we are going to be doing some programs on emergency planning, which will include digitization, DEIA, and also some development programs that are going to be coming up in the next 4 to 6 months. So please keep an eye out for those. Any final words from our speakers? Thank you so much for being here.
Thank you.
Thank you.
All right, have a great day, everybody.
Bye-bye.
Bye.
Bye.